So BSI seen as safe. I'm here for an MOI of a broken arm, but there's only one single patient. And so I don't need any ALS units, don't need any additional EMS units, but I will have my partner call fire for the lift assist with this patient. So I'm gonna go ahead and have my partner do that while I continue talking to the patient. So, hi my friend, my name is Colton, I'm an EMT. Can you just let me know what's going on right now? What the problem you're having is? Okay, so patient's primary complaint is that while they were hiking, they were going down a bit of a downhill slope, and they slipped and tried to reach out to grab something, and they accidentally slammed their arm onto a rock and fractured their right ulna. So I'm going to have my partner provide manual stabilization on that right forearm as I'm continuing on with the rest of the patient assessment myself. So my friend, can you tell me where you are right now? Okay, and do you know what your name is? And do you know what time of day it is? Perfect. And last question, do you know what we're doing right here? What's going on right now? Perfect. So patient is awake and oriented, alert and oriented ×4, which is good to see. So my general impression is just that this is a 32-year-old male who is lying on the ground in the supine position after having broken his arm while hiking. So now I'm going to move on with the ABCs. And first things first, I'm going to go ahead and do the jaw thrust maneuver to make sure that the airway is open and clear. And the airway is open and clear, which is good. And the patient has been speaking to me, so I know their airway is patent and self-maintained, which is good to see. Now I'm going to go ahead and move on to the breathing. So I'm going to expose the chest and inspect it for any sorts of injuries there that I might see. And I'm not seeing any injuries to the chest, which is good. I'm going to go ahead and palpate it now to feel for any deformities or paradoxical motion or anything like that. Not feeling anything there, so the chest is all good, or at least physically speaking. I'm going to go ahead and auscultate the lungs to see if anything's going on there in 2 places. And the lung sounds are both, they're bilateral and they are both normal. So now I'm going to go ahead and, well, the thing is that this patient does not have any open chest wounds or anything like that, so I don't need to cover any of them up or dress any of them, but I am going to go ahead and administer 15 liters of oxygen per minute to this patient via non-rebreather. So I'm going to go ahead and do that right now. And now I'm going to move on to the circulation. First things first, I'm going to check for any bleeding. No bleeding from the neck void. No bleeding from the back void. None underneath the knee voids. And none for the ankle voids, which is good. Now I'm going to check the radial pulses. And both of them are strong and present. Now the skin condition is just warm, pink, and dry. And so then the next step is that I'm going to identify this as a low priority patient, and I'm going to call the incoming fire units and update them with the information that I have identified this as a low priority patient because he only has the one extremity injury and no other significant injuries or life threats or anything like that. And the fact that I'm administering oxygen to the patient as well, and we'll just be needing their assistance with the lift. So now that I've updated the incoming units, I'm going to go ahead and apply the splint. So before I actually put the splint on, I'm going to go ahead and do PMS. Can check the radial pulse, present and strong. My friend, can you go ahead and tell me which finger I'm pinching and then also wiggle your fingers for me? Perfect. So PMS is good. Now I'm going to go ahead and put the splint on. I'm going to put it on with a pad between the patient's arm and the splint itself, and then I'm going to secure the splint in place with 2 cravats or triangular bandages. And I'm also going to put a cravat in the patient's hand itself so that the hand can stay in the position of action. And now that I've got all that done, I'm going to go ahead and do PMS again, just to make sure nothing's changed. Pulse is still strong and present as it was before. My friend, can you go ahead and tell me which finger I'm pinching and wiggle your fingers for me? Perfect. So PMS is also still good even after having applied the splint. So now I'm going to go ahead and move on with the rapid head-to-toe scan. I'm going to palpate the skull for any deformities or fractures, and there are no deformities on the head, on the skull. Now I'm going to go ahead and inspect the neck for any sorts of deformities on the front, sides, and the back as well. No deformities, no tracheal deviation, and no jugular vein distension, so the neck is all good to go. But I am still going to apply a C-spine collar to the patient just in case, so that nothing else can potentially happen to the C-spine during transport. Now I'm going to go ahead and inspect the chest again. I'm going to palpate it once more for any sorts of deformities or paradoxical movement, tenderness, swelling, whatever. Everything feels normal on the chest. Now I'm going to go ahead and auscultate the lungs in 4 different places. Lung sounds still bilateral and normal as they were before, so that's good. Now I'm going to go ahead and palpate the abdomen, just the whole thing in one swoop, and there are no deformities, no rigidity or distension there. Now I'm going to go ahead and inspect the pelvis, and for its stability, I'm going to push in and then push down, or pull and then push down, and that the pelvis feels stable. So that's good. I'm going to go ahead and palpate the arms. The right arm feels fine. I'm going to palpate the upper arm and carefully palpate around the right forearm everywhere except for on the directly on the injury itself. And the arms feel fine. Now I'm going to palpate the legs. And the legs feel fine as well. So now that I've done the rapid body scan, I'm going to go ahead and take the patient's vitals, and then I will be doing sample as well. So I'm going to start off by taking the patient's pulse. And the pulse is about 102 beats per minute, and the pulse is strong as well. And now I'm going to go ahead and take the blood pressure. And the blood pressure is 129 over 87. So nothing too crazy there. And now I'm going to go ahead and check the respirations. Respirations are about 19 per minute. They seem a little fast, but that's to be expected given the situation, and they otherwise seem normal. Not particularly labored or anything like that. So now that I've gotten the patient's vitals, I'm going to go ahead and take sample. So, my friend, are there any other sorts of symptoms that you're experiencing right now other than the broken ulna, or is that it? Okay. And do you have any allergies? No allergies, got it. Do you take any medications? None. Okay, no medications. Do you have any past medical history, like say for example any breaks or anything, any fractures? Okay, so patient does have a history of having broken their right ulna about a year ago as well. So that is something I'm going to take a note of. And so my friend, what was the last thing that you drank or ate today? Okay, and what happened leading up to the event? Was it just the slip there, or was there anything else that happened beforehand that seemed like it might have contributed to the break, contributed to what happened? Nothing. Okay, so it was just the slip and fall on that hill. So now that I've gotten sample, I'm going to go ahead and move on to the more thorough head-to-toe exam. I'm going to palpate the skull again for any deformities or fractures. Still no deformities or fractures there. I'm going to go ahead and check the ears for any cerebrospinal fluid. And there is no cerebrospinal fluid there. I'm going to go ahead and inspect the nasal and oral cavities as well. Those are both clear. And now I'm just going to check the patient's pupils. And the patient's pupils are equal in size and equally reactive to light bilaterally. So now I'm going to go ahead and re-inspect reassess the neck through the C-spine collar for again any deformities, JVD, or tracheal distension, tracheal motion, and none of that. It all seems good to go. And so now I'm going to go ahead and check the chest again, feeling for any deformities or paradoxical movement. None of that. So I'm going to go ahead and listen in 6 places. And the chest, the lung sounds are bilateral on both sides, even having listened in 6 places, which is good to see. So now I'm going to go ahead and palpate the abdomen in 4 places, 4 quadrants. Once again, no deformities or distension or rigidity or anything like that on the abdomen. Now I'm going to inspect the pelvis again, inspect its stability one more time, pull in and push down. I'm also going to inspect the genitals for any potential injuries. Everything seems good. And so now I'm going to go ahead and once again palpate the arms and then also do PMS. I'm going to do the left arm first. All right, no deformities after the palpation. My friend, can you tell me which finger I'm pinching and then wiggle your fingers for me? Okay, perfect. And then I'm checking the pulse. Pulse is present and strong. Then of course being careful of the right arm, checking the pulse first. Pulse is present and strong. My friend, are you able to wiggle your fingers for me and can you tell me which one I'm pinching? Perfect. PMS is good on both arms. Now I'm just going to gently palpate the right arm as well. And just, again, aside from the right ulnar fracture, no deformities there. Now I'm going to go ahead and do the same for the legs, palpate them. And then do PMS. My friend, I'm going to check the brachial, the pedal pulse first. Present and strong. My friend, can you tell me which toe I'm pinching and then wiggle your toes? Perfect. And can you do the same thing again? Tell me which toe I'm pinching and then wiggle your toes. Perfect. And then checking this other brachial pedal pulse. And it's also present and strong. So PMS is good on both legs and there are no deformities on the legs. And so now I am going to go ahead and have Fire help me lift the patient into the ambulance. This is a low priority patient who is stable, so I'm only going to be reassessing the patient every 15 minutes. And I'm going to call into the hospital and leave them a report of everything that's gone on. So I'm going to tell them the general impression, which is that this is a 32-year-old male who I found lying in the supine position on the ground after having broken his arm while hiking. And he has a right ulnar fracture, but no other injuries of any sort. And his blood pressure was 129/87, and his pulse was 102 beats per minute. And his skin is pink, warm, and dry. And I'm going to let them know that I have been administering oxygen at 15 liters per minute via non-rebreather, and I've also splinted his right arm, his right forearm, and that we are on our way. And that concludes the hospital report. And once again, I will be reassessing the patient every 15 minutes as we drive to the hospital. And that concludes my patient assessment.